Get her out of the way. Now." The voice cut through the controlled chaos of the trauma bay like a shard of glass. It was sharp, cold, and dripping with a contempt that was almost physical. Dr. Richard Hartwell, Chief of Surgery at Seattle Grace Hospital, pointed a rigid, manicured finger. Not at a misplaced piece of equipment. Not at an intern fumbling a task. He was pointing at Sarah Mitchell. She was a 42-year-old ER nurse, her hands moving with the fluid, unthinking efficiency that only comes from a decade of nights spent in the crucible of emergency medicine. One hand was applying steady pressure to a bleeder on the patient's abdomen, while the other was preparing a line for a dopamine drip. The patient, a victim of a multi-car pileup, was circling the drain. His pressure was bottoming out. The air was electric with the frantic rhythm of the heart monitor and the clipped, urgent calls for vitals and meds. Sarah was in her element. She was a calming presence in the storm, her focus absolute. "I said, move," Hartwell repeated, his voice louder now, laced with a dangerous impatience. He shoved past a junior resident, his expensive Italian shoes squeaking on the linoleum. "We're losing him because this nurse is too dumb to assist properly. Get her out." The words landed like a physical blow. Too dumb to assist. In front of the entire trauma team. In front of the wide-eyed residents who hung on his every word. In front of the other nurses who now stared at the floor, their faces tight with a mixture of fear and second-hand shame. Sarah looked up. Her eyes, usually warm and steady, met his. Hartwell was a man who commanded space, tall and silver-haired, with the arrogant posture of someone who had never been told no in his professional life. His face was a mask of fury, but it wasn't the focused anger of a surgeon fighting for a life. It was the petty rage of a king whose decree was not instantly obeyed. "Doctor, Hartwell, I have the bleeder under control," Sarah said, her voice low and even, a stark contrast to his tirade. "If you could just—" He didn't let her finish. With a grunt of disgust, he reached down, grabbed her shoulder, and physically shoved her aside. It wasn't a gentle push. It was a violent, dismissive act. Sarah stumbled backward, catching her balance against a supply cart. A tray of sterile instruments clattered to the floor. The room went silent. The only sound was the failing beep of the heart monitor. Hartwell ignored her, his attention now on the patient. "Give me a clamp. Someone with a brain. Get me a clamp." Sarah stood there for a single, frozen second. The heat of humiliation washed over her, hot and prickling. She could feel every eye in the room on her. They saw a black nurse in simple blue scrubs being publicly degraded by the most powerful surgeon in the hospital. They saw her being called stupid. They saw her being physically pushed away from the patient she was trying to save. She could have walked out. She could have gone to the charge nurse, filed a complaint that would inevitably be buried, and requested a transfer. She could have quit. Any sane person would have. But here's the thing nobody in that room knew. They didn't know that the woman they saw as just a nurse had spent the previous 10 years not in an ER, but in the sterile, high-stakes theater of cardiothoracic surgery. They didn't know that her hands, which Hartwell had just shoved away, had performed over 2,000 open-heart procedures. They didn't know that just 18 months ago, her nameplate didn't say, Sarah Mitchell, RN. It said, Dr. Sarah Mitchell, Chief of Cardiovascular Surgery, Mayo Clinic. Hartwell was now fumbling, blindly applying a clamp, causing more damage. The patient's blood pressure plummeted further. The monitor screamed a continuous, flat tone. "He's coding," a resident shouted. Hartwell started barking orders for the crash cart, his confidence finally cracking, a flicker of panic in his eyes. He had made a mistake, a big one. Sarah took a deep breath. She looked at the dying man on the table. She looked at the arrogant doctor who had humiliated her. And she made a choice. She pushed herself off the cart, her spine straight as steel, and walked back towards the table. What happened next would not only change the fate of the man on the table, it would dismantle a dynasty of arrogance and injustice, brick by painful brick. Richard Hartwell had just picked a fight with a ghost, and he was about to find out how sharp her scalpel still was. The immediate aftermath was a blur of controlled activity that did little to mask the raw, gaping wound of the incident. Another attending, Dr. Evans, the head of the ER, had taken over the code after Hartwell's initial, clumsy attempts at resuscitation failed. Sarah, without being asked, had stepped back in, not to the prime position, but to the periphery, her hands once again a blur of efficiency. She drew up medications before they were called for, labeled syringes with a Sharpie, and kept a running tally of the epinephrine and atropine doses on a whiteboard. She did her job perfectly. She didn't make eye contact with Hartwell, who stood by the wall, his arms crossed, his face a thunderous mask. He was observing, critiquing, his presence a toxic cloud in the room. He had been sidelined from his own mess, and his ego was hemorrhaging. They got the patient back. Barely. A faint, thready pulse returned. He was stabilized for transfer to the ICU, a breathing tube down his throat, his life hanging by the thinnest of threads. As the team was cleaning up, the adrenaline fading and leaving behind a grim exhaustion, Maria Diaz, another veteran nurse and Sarah's closest friend at the hospital, came to her side. "I saw it, Sarah," Maria said, her voice a low, furious whisper. "I saw the whole thing. He put his hands on you." Sarah was methodically wiping down a counter, her movements precise, almost robotic. "I'm fine, Maria." "No, you're not fine. That was assault. And what he said, in front of everyone. The residents were looking at you like you were dirt." Maria's dark eyes flashed with anger. "You have to report this. Not to the unit manager, to the board, to a lawyer." "And what happens then?" Sarah asked, her voice flat. She stopped wiping and looked at her friend. "He's Richard Hartwell. He brings in more money for this hospital than the entire orthopedic department combined. They're not going to touch him. They'll open an investigation. HR will have a quiet word with me about professional conduct and managing difficult personalities, and I'll be labeled a troublemaker. My shifts will get worse. My assignments will get harder. I've seen it happen." "This was different," Maria insisted. "He shoved you. He'll say it was a high-pressure situation. He'll say I was in the way. He'll say he was trying to save a patient's life. And they will believe him." Sarah threw the soiled wipe into a biohazard bin with more force than necessary. "Because he's Dr. Hartwell. And I'm just a nurse. Just a nurse." The words tasted like ash in her mouth. Here's what Hartwell and everyone else at Seattle Grace didn't understand. Sarah Mitchell hadn't become just a nurse because she'd failed at being a doctor. She had been at the absolute pinnacle of her profession. A prodigy who finished medical school at 23 and her cardiothoracic fellowship at 29. At the Mayo Clinic, she wasn't just a surgeon. She was an innovator, pioneering minimally invasive valve replacement techniques that were now standard practice across the country. She published papers. She taught fellows. She held life and death in her hands daily, and she rarely, if ever, lost. Then, Her world had collapsed. Her daughter, Lily, then 8 years old, was diagnosed with a rare and aggressive form of juvenile rheumatoid arthritis. The disease attacked her joints, her organs, her life. The prognosis was grim. The required treatment was intensive, experimental, and involved near constant hospital stays and specialist visits. Sarah couldn't be a mother and a chief of surgery, not the kind of mother Lily needed. The 100-hour work weeks, the emergency calls at 3 a.m., the all-consuming pressure, it was impossible. So she made a choice. She walked away. She resigned her position, cashed out her investments, and moved them both to Seattle for a revolutionary new treatment program at a children's hospital there. She took 2 years off completely, dedicating every moment to Lily's care. When the new treatments finally began to work, when Lily started to reclaim her childhood, Sarah knew she needed to work again. Not for the prestige, not for the title, for the practicalities. The medical bills were astronomical, and she needed a flexible job with good insurance that would allow her to be there for Lily's appointments, for the flare-ups, for school plays. So she renewed her nursing license, a credential she'd held since before medical school, and took a night shift ER position at Seattle Grace. It was anonymous. It was practical. It was supposed to be simple. She kept her head down. She did her job. She never mentioned her past. It was a life she had chosen, a sacrifice she had made without a second thought. It was her secret armor. Until today. Today, Richard Hartwell had taken that choice, that sacrifice, and twisted it into a weapon of humiliation. Later that night, in the sterile quiet of the nurse's locker room, Sarah changed out of her scrubs. She could still feel the phantom pressure of his hand on her shoulder. She looked at her own hands. These were the hands that had sutured an aorta the width of a human hair. These were the hands that had massaged a still heart back to life inside an open chest. Today, they had been deemed unworthy to even hold a clamp. She sat on the bench, her phone in her hand. She could call her old mentor at Mayo. She could call the lawyer who handled her resignation. She could ignite a fire that would burn Hartwell to the ground. But her first thought was of Lily. A fight like that would be messy, public. It would consume her. It would take her away from her daughter again. The reason she had given it all up in the first place. Then her phone buzzed. It was a text from Maria. Patient from the trauma bay, Mr. Henderson. Hartwell put in the transfer orders. He listed the primary cause of the code as complication due to initial triage error. He's blaming the floor nurses. Sarah's blood ran cold. He wasn't just trying to cover his tracks. He was actively trying to ruin someone else's career to save his own skin. He was blaming the initial nurses who received the patient, nurses who had followed protocol to the letter. He was going to sacrifice them. That was it. That was the moment the calculation changed. This was no longer just about her own humiliation. It was about him using his power to destroy the careers of good, hard-working people who didn't have the resources to fight back. It was about the safety of every patient who came through those ER doors. She stood up. The exhaustion was gone, replaced by a cold, clear resolve. He thought she was just a nurse. He thought she was powerless. He thought she was dumb. She pulled out her laptop from her locker. She opened a new, password-protected document. She typed a single line at the top. Incident log. Dr. Richard Hartwell. Date, October 26th. Then she began to write. She documented the time of the incident, the exact words he used, the names of every single person in the room, the vital signs of the patient before, during and after Hartwell's intervention, the incorrect clamp placement, the wrong medication he almost ordered. She wrote with the meticulous, irrefutable precision of a scientist documenting a flawed experiment. This was no longer a matter of personal pride. This was a matter of professional ethics. It was a matter of justice. Hartwell had started a war. He just didn't realize his opponent had an entire arsenal he couldn't even imagine. The next few days at Seattle Grace were thick with a toxic quiet. The story of what happened in Trauma Bay 2 had spread through the hospital's gossip network like a virus. Nurses whispered in the break rooms. Residents avoided Sarah's gaze in the hallways. Everyone knew, and everyone was waiting to see what would happen. Hartwell, for his part, acted as if nothing had occurred. He strode through the wards with his usual air of untouchable authority, a coterie of nervous residents trailing in his wake. In the hospital cafeteria, he held a court, his booming laugh echoing off the tiled walls. Sarah saw him from across the room, sitting with the hospital's chief financial officer. He leaned in, telling a story, and then gestured dismissively with his hand. The CFO laughed. It was a clear message. I am powerful. You are nothing. The incident is already forgotten. But Sarah hadn't forgotten. Her log grew longer each day. She wasn't just documenting her own incident. She was starting to look at the bigger picture. She spent her off hours in the hospital's digital archives, a privilege afforded to all nursing staff. She wasn't looking for HR complaints. Those would be buried. She was looking at data. She pulled up complication rates for post-operative patients, mortality and morbidity reports. She started cross-referencing them with the attending surgeon of record. A pattern began to emerge. A subtle but statistically significant one. For routine procedures, appendectomies, cholecystectomies, Hartwell's numbers were average. But for high-risk, complex surgeries, his patients had a 15% higher rate of post-op infection and a 10% higher rate of readmission than the other senior surgeons. It was the signature of a surgeon who was confident, perhaps overly so in the operating room, but lazy and dismissive with post-operative care. He was a showman, not a caretaker. He liked the cutting, not the healing. And then she found something else, something colder. She started looking at the nurses who had been assigned to his most difficult post-op cases. Over the past 5 years, 6 nurses had been formally disciplined for medication errors or failure to follow protocol while caring for Hartwell's patients. All 6 had been nurses of color. 5 were black women. 1 was a Filipino man. All 6 had either been fired or had resigned shortly after the disciplinary action. Not once, not twice, 6 times. Sarah felt a chill crawl up her spine. This wasn't just arrogance. It was a system. He used minority nurses as scapegoats. When a complex case went sour because of his own lack of follow-through, he would find a tiny discrepancy in the charting, a minor deviation in the timeline of a medication dose, and magnify it into a catastrophic failure on the part of the nurse. He had a playbook, and he had used it to destroy careers. "What are you doing?" Sarah jumped, quickly minimizing the screen. Maria was standing behind her, a cup of coffee in her hand. "Research," Sarah said simply. Maria peered at the screen before Sarah could fully hide it. She saw the columns of data, the names. "Are those the nurses from the 3rd floor? The ones who got fired last year?" Sarah nodded, pulling the screen back up. "And the year before, and the year before that." Maria's face hardened. "I remember Elena Reyes. She was a great nurse. Hartwell claimed she missed a dose of antibiotics on that bowel resection patient who went septic." Elena swore she gave it, that the system just didn't register the scan. Nobody believed her. She lost her license. The patient's white blood cell count was already climbing 6 hours before the missed dose was even alleged, Sarah said, pointing to a data point on the screen. The infection was already brewing. Hartwell missed the signs on his morning rounds. He needed someone to blame. The scope of it, the sheer, calculated cruelty, was breathtaking. This was a man who didn't just have a God complex, he demanded human sacrifices to maintain it. That evening, Sarah's focus was pulled back to the present. Mr. Henderson, the patient from the code, was still in the ICU. His condition was unstable. Sarah, using her friendship with one of the ICU charge nurses, got a look at his chart. Hartwell had him on a standard post-arrest protocol, but Sarah saw something he had missed. A subtle, prolonged QT interval on his EKG. It was a small detail, a whisper, but to a trained cardiologist, it was a scream. Combined with a slight dip in his magnesium levels, it was a classic precursor to a potentially fatal arrhythmia. Torsade de pointe. The very thing she had suspected during the code. The standard drugs Hartwell was pumping into him were actually making the condition more likely to recur. She had to do something. She found the resident on duty for the ICU, a young man named Dr. Chen. He looked perpetually exhausted and terrified. "Dr. Chen," Sarah began, keeping her voice calm and non-confrontational. "I was looking at Mr. Henderson's telemetry. I'm concerned about his QT interval." Chen glanced at the monitor, then back at his own charts. "It's a little long, but that's not unusual post-arrest, with the amiodarone drip." "But his magnesium is also low," Sarah pressed gently. "It's a dangerous combination. He's at high risk for torsades. Maybe we should consider switching from amiodarone to a lidocaine infusion and starting a magnesium drip." Chen's eyes widened in fear. Not at the medical reasoning, but at the suggestion itself. "Dr. Hartwell personally wrote these orders. He wants him on amiodarone. If I change it, he'll have my head." "It's the right call for the patient," Sarah said, her voice firming. "The evidence is right there on the screen." "I can't," Chen whispered, shaking his head. "You don't understand. Last month, I questioned one of his orders, and he had me on scut work for 3 weeks. Said I didn't have the clinical judgment for the ICU. I can't risk it." He wouldn't even look at her. He just scurried away. Sarah stood there, feeling a profound sense of dread. The system wasn't just protecting Hartwell, it was enforcing his malpractice. The fear he inspired was so absolute that it overrode the medical judgment of other doctors. It was going to kill someone. It was going to kill Mr. Henderson. She had one last option, a direct confrontation. She found Hartwell in his office, dictating notes. He looked up when she entered, his expression turning from irritation to outright disdain when he saw who it was. "What do you want?" he snapped, not bothering with pleasantries. "Dr. Hartwell, it's about Mr. Henderson," Sarah said, standing her ground in the doorway. "His EKG is showing a prolonged QT interval, and he's hypomagnesemic. Continuing amiodarone is dangerous. I strongly urge you to reconsider his medication." Hartwell leaned back in his leather chair, a smirk playing on his lips. It was the most infuriating expression Sarah had ever seen. It was the look of a man who was enjoying this. "Nurse Mitchell, is it?" he said, feigning forgetfulness. "Let me be very clear. You are a nurse. You clean up messes and you hand me things. You do not practice medicine. You do not question my orders. And you certainly do not strongly urge me to do anything." He stood up and walked towards her, his physical presence designed to intimidate. "I heard about your little outburst in the trauma bay," he continued, his voice dropping to a low, menacing tone. "A formal complaint has been filed against you for insubordination and creating a hostile environment. So if I were you, I would go back to whatever hole you crawled out of, keep your mouth shut, and pray you still have a job next week." He stood there, blocking the doorway, waiting for her to retreat, to crumble. But Sarah didn't move. She just looked him straight in the eye. "The patient is going to have another cardiac event, Dr. Hartwell, and when he does, it will be because you were too arrogant to listen. That won't be my opinion. It will be a medical fact." She turned and walked away, her heart pounding not with fear, but with a terrible, chilling certainty. The crisis was no longer a possibility. It was an inevitability. He had set the timer on a bomb, and now all she could do was wait for it to explode. The call came 3 hours later. "Code Blue, ICU Room 4. Code Blue, ICU Room 4. The voice over the hospital intercom was sharp with panic. "ICU Room 4. Mr. Henderson." Sarah was just finishing her shift charting when she heard it. A cold dread, mingled with a grim sense of vindication, washed over her. She ran. She didn't think. Her body just moved, propelled by years of instinct. When she burst into the ICU room, it was chaos. Mr. Henderson was convulsing on the bed, his back arched. The heart monitor was screaming, its waveform a bizarre, twisting pattern that Sarah recognized instantly. Torsades de pointe, the twisting points, exactly what she had predicted. Dr. Chen was frantically trying to place defibrillator pads on the patient's chest. A nurse was fumbling with a vial of epinephrine, and standing at the foot of the bed, looking pale and shaken, was Dr. Hartwell. He had been on his way out of the hospital when the code was called. Now he was trapped, the star witness to his own catastrophic failure. "Push one of epi," Hartwell commanded, his voice strained. "No." Sarah's voice cut through the room like a whip crack. Every head turned towards her. Hartwell's face, already pale, turned a mottled shade of red. "How dare you?" he sputtered. "Get out of this room. Security." "Epinephrine will make it worse," Sarah shouted back, ignoring him completely and walking directly to the crash cart. She was no longer a nurse asking for permission. She was a commander taking control of a battlefield. "He's in Torsades, you idiot. Look at the monitor. He needs magnesium. Now." She grabbed a vial and a syringe, her hands steady, her movements economical. She drew up 2 grams of magnesium sulfate in seconds. "Give this, IV push, now." She ordered the nurse next to her, who was staring at her, paralyzed with indecision, looking back and forth between the furious Chief of Surgery and this suddenly authoritative ER nurse. "Don't you touch that syringe," Hartwell roared. "You will be fired. I will have your license." "There won't be a patient left to treat if you keep making the calls," Sarah shot back. She turned to Dr. Chen. Her voice dropped, becoming focused, precise, the voice of a teacher, not a scold. "Dr. Chen, what is the standard ACLS protocol for torsades de pointe with a pulse?" Chen blinked, the textbook answer rising through his panic. Magnesium sulfate, 1 to 2 grams IV over 5 to 60 minutes. "And if they're coding?" Sarah pressed. Then you push it," he whispered, his eyes wide with dawning comprehension. Push it," Sarah said, her eyes locking with the other nurses. "Now." The nurse, finally breaking from Hartwell's spell, took the syringe and injected it into Mr. Henderson's IV line. Hartwell looked as if he'd been struck. "I am the Chief of Surgery here. you will listen to me. Charge the defibrillator to 150, unsynchronized, Sarah commanded, completely ignoring him. She was grabbing the paddles herself. Clear. The team, now instinctively following her lead, jumped back. The machine delivered the shock. Mr. Henderson's body jolted. For a second, the twisting rhythm on the monitor continued. Then it wavered, and then, miraculously, it converted. A steady, if rapid, sinus rhythm appeared on the screen. Beep, beep, beep. The sound of life. The room was utterly silent. Everyone was staring at Sarah. She stood over the patient, chest rising and falling with exertion, the defibrillator paddles still in her hands. Hartwell was speechless. His jaw worked, but no sound came out. He looked from the monitor to Sarah, his eyes filled with a confusion so profound it bordered on madness. Dr. Evans, the ER chief who had run the first code, had arrived mid-chaos and had been watching from the doorway, his face unreadable. He was the one who finally broke the silence. "How did you know that?" Evans asked, his voice quiet, respectful. He wasn't talking to Hartwell. He was talking to Sarah. That was a 1 in 1,000 diagnosis to make that quickly, under pressure. Sarah put the paddles back on the cart. She took a breath. This was it, the moment of truth. "It's not 1 in 1,000 when you've seen it 100 times, she said, her voice tired but clear. She looked directly at Hartwell, whose face had gone from red to a pasty, sickly white. "And it's an easy diagnosis to make when you wrote the updated treatment protocol for the American Heart Association's 2020 guidelines on refractory ventricular arrhythmias." A collective gasp went through the room. "Doctor." Chen's jaw literally dropped. Evans took a step forward. Who are you?" Sarah finally allowed herself to meet Hartwell's horrified gaze. She held it. She wanted him to see. She wanted him to understand the colossal scale of his mistake. "My name," she said, her voice ringing with the authority she had hidden for 2 long years, "is Dr. Sarah Mitchell. I was, until 18 months ago, the Chief of Cardiovascular Surgery at the Mayo Clinic in Rochester." The silence that followed was more profound, more deafening than any alarm. It was the sound of a world turning upside down. The residents, the nurses, Dr. Evans, they were all staring at her as if she had just sprouted wings. They were replaying the last few days, the last few hours, the last few minutes in their minds. The humiliation in the trauma bay, the condescending dismissal in the office, the sheer, blind arrogance. Hartwell just stood there, swaying slightly. All the blood had drained from his face. He looked like a statue, a monument to his own hubris, crumbling from the inside out. He opened his mouth, and a dry, croaking sound came out. That's not possible." Sarah didn't even grace him with a response. She turned back to Dr. Chen. "Get him on a lidocaine drip, 1 to 4 milligrams per minute," she said, her tone all business. "And let's get a full metabolic panel and check his potassium. Let's make sure we know what we're treating." Dr. Chen, looking at her with a reverence usually reserved for gods, just nodded dumbly. "Yes, doctor. Right away, doctor." He had called her doctor. Sarah looked around the room, at the faces of the nurses who were now beaming with fierce, protective pride. At the residents who were looking at Hartwell with a dawning, undisguised contempt. The power in the room had not just shifted. It had undergone a tectonic reversal. Hartwell finally found his voice, a pathetic, reedy thing. "You're lying. This is some kind of trick." Before Sarah could respond, Maria Diaz, who had followed Sarah into the room, stepped forward, her phone in her hand. "Is she?" Maria said, her voice dripping with ice. She held up her phone. On the screen was the official staff page from the Mayo Clinic's website, archived but still accessible. There was a picture of a smiling, confident woman in a pristine white coat. Underneath it, the caption read, Sarah Mitchell, M.D., Ph.D., Chief, Department of Cardiovascular Surgery. Maria tilted the phone so Hartwell could see. Does that look like she's lying? He stared at the screen, at the face he had called dumb, at the title he could never hope to achieve. And in that moment, he finally, truly understood. He wasn't just wrong. He was ruined, and the person who had ruined him was the woman he had dismissed as nothing. The emergency board meeting was convened less than 12 hours later. It wasn't a quiet HR affair. This was a full-blown crisis, and the hospital administration was in full panic mode. The attendees included the hospital CEO, Charles Lawson, a man who valued profit margins above all else, the chief of medicine, Dr. Annabelle Reed, the hospital's top legal counsel, and the entire executive board. And, of course, Dr. Richard Hartwell, who sat at one end of the long mahogany table flanked by a smug-looking lawyer. He had regained some of his composure. He was dressed in an immaculate suit, his silver hair perfectly coiffed. He looked ready for a fight, confident that the institutional inertia and his own donor-friendly reputation would protect him. At the other end of the table sat Sarah. She wasn't in scrubs. She was wearing a simple, well-tailored black dress. She looked poised, calm, and utterly unintimidated. Beside her sat Maria Diaz and Dr. Evans. They weren't there as her support system. They were there as witnesses. Lawson started the meeting, his face grim. We are here to discuss a series of grave allegations concerning patient care and professional conduct. Dr. Hartwell, we have a report of a serious incident in the ICU last night and another in the ER 2 days prior. Hartwell's lawyer, a man named Peters, spoke up immediately. Mr. Lawson, my client acted in the best interest of the patient in 2 highly volatile life-or-death situations. The person who should be under review is Miss Mitchell, a nurse who repeatedly overstepped her authority, violated hospital protocol, and administered medication against the direct orders of the attending physician. She is a rogue employee, a danger to this hospital. Sarah remained silent. She let him talk. She let him build his own gallows. Dr. Reed, the chief of medicine, looked at Sarah. Miss Mitchell, or Dr. Mitchell, we've obviously verified your credentials. They are, to put it mildly, impeccable. The question everyone has is, why didn't you say anything? Sarah met her gaze. Because my history is not relevant to my ability to perform my duties as a registered nurse, and because I shouldn't have to present a resume to be treated with basic human and professional respect. My concern isn't about my title, it's about Dr. Hartwell's pattern of behavior, which actively endangers patients. A baseless accusation, Peters interjected. Dr. Hartwell is one of the most respected surgeons in the country. Is he? Sarah asked quietly. She slid a thin folder across the table towards Lawson. Then perhaps you can explain this. Lawson opened the folder. Inside was the first page of Sarah's log. It detailed the incident in Trauma Bay 2 with timestamps, direct quotes, and a list of the dozen people present. He said I was too dumb to assist, Sarah said, her voice steady and clear, filling the silent room. He physically shoved me away from a patient who was actively bleeding out. His actions were not those of a surgeon in control, they were those of a bully. Hartwell scoffed. It was a chaotic scene. I needed to get to the patient. She was in the way. This is a ridiculous overreaction. Was it an overreaction when you tried to blame the code on the triage nurses? Dr. Evans cut in, his voice sharp. He slid another document across the table, a copy of Hartwell's initial report. You falsified a report to cover your own error in managing the patient's hemorrhage. That's not just poor judgment, that's fraud. Hartwell's lawyer started to protest, but Sarah wasn't finished. And what about Mr. Henderson's second code? She continued, her voice gaining strength. The one I predicted 3 hours before it happened? I personally warned Dr. Hartwell that the patient was at extreme risk for torsades de pointe. I explained the EKG findings and the electrolyte imbalance. His response was to threaten my job and call me incompetent. She looked directly at Hartwell. You didn't just miss the diagnosis, doctor. You were given the diagnosis and you threw it in the trash because you couldn't stand to be corrected by a nurse, by a black woman. This is character assassination, Hartwell boomed, slamming his hand on the table. She has a personal vendetta. Is it a personal vendetta, Dr. Hartwell? Sarah said, her voice dropping to an icy calm. Or is it a pattern? She slid the rest of her research across the table, the data on his complication rates, and the list of the 6 nurses of color who had been fired or forced to resign after being blamed for his mistakes. Elena Reyes, Sarah said, reading the first name. Fired for a supposed medication error on your patient who went septic, a patient whose signs of infection you missed for 10 hours. Marco Vega, she continued, resigned after being written up for failing to report a drop in urine output on a post-op kidney patient. A patient you hadn't personally rounded on in over 36 hours. She went down the list, name by name, case by case. With each name, she provided the data she had uncovered, the lab results that showed the problem existed long before the nurse was involved, the charting notes that proved Hartwell's own negligence. It was a systematic, methodical demolition. The room was dead silent. Lawson was staring at the documents, his face ashen. The board members were looking at Hartwell with open horror. His lawyer, Peters, was no longer looking smug. He was flipping through the pages, his expression growing more concerned with each name. Then the final blow. Dr. Reed cleared her throat. In light of these allegations, we asked HR to pull Dr. Hartwell's unredacted file this morning. It seems there were other complaints. 4 of them over the last decade, all from nurses, all alleging verbal abuse and discriminatory language. All of them were deemed unsubstantiated by Dr. Hartwell's previous supervisor. Hartwell's head snapped towards her. Those were confidential. Not anymore, Reed said coldly. The door to the boardroom opened. A young man in scrubs stood there, looking nervous but determined. It was Dr. Chen. "Excuse me," he said, his voice shaking slightly. "I was told to come here. I was the resident on duty for Mr. Henderson." Lawson nodded. "Please, come in." Chen walked to the table. He wouldn't look at Hartwell. He looked at Sarah and then at the board. "Nurse Mitchell." "Dr. Mitchell. She warned me," Chen said, his voice growing stronger. "She told me exactly what was going to happen to Mr. Henderson. She showed me the EKG. I knew she was right, but I was afraid. I was afraid of him." He finally chanced a look at Hartwell. "He cultivates an environment of fear. We are all too scared to question him, even when we know he's wrong. He's a danger to patients. What Dr. Mitchell did. She didn't just save that man's life. She did what none of the rest of us had the courage to do. She told the truth. That was it. The final nail. The testimony of a doctor confirming the culture of fear. Hartwell slumped in his chair. The fight was gone. He looked old and small and pathetic. I built the surgical program here," he whispered, a last desperate appeal. "My name brings in millions in donations." Lawson, the CEO who lived and died by the bottom line, looked at him with pure, cold fury. "Your name is about to be attached to the biggest malpractice and discrimination lawsuit in this hospital's history. You are not an asset, Richard. You are a multi-million-dollar liability." He looked around the table. "I call for a vote. A motion to immediately terminate Dr. Richard Hartwell's contract and suspend his hospital privileges for cause." "Seconded," Dr. Reed said instantly. "All in favor?" Every single hand around the table went up. Even Hartwell's lawyer just sat there, defeated. It was unanimous. Lawson looked at Hartwell. "Security will escort you from the building. Your office will be cleared out and your personal effects mailed to you. You are not to set foot in this hospital again." Hartwell just stared, his mouth agape. He had been so powerful for so long, he simply could not process his own destruction. As two security guards entered the room and stood behind his chair, he finally looked at Sarah. His eyes were not angry anymore. They were filled with a pleading, desperate confusion. He was looking for an explanation for how his entire world had been dismantled in less than a day. Sarah met his gaze one last time. She gave him no anger, no pity, no satisfaction. She gave him nothing. She had already turned the page. 6 months later, the nameplate on the door to the corner office of the cardiothoracic department was new. It was polished brass, and it read, "Dr. Sarah Mitchell, Chief of Cardiology." The changes at Seattle Grace had been swift and seismic. Hartwell's firing had sent shockwaves through the institution. He was facing 3 separate malpractice lawsuits, including a multi-million-dollar suit from Mr. Henderson's family. The state medical board had suspended his license pending a full investigation. The 6 nurses whose careers he had destroyed had joined a class action lawsuit against the hospital, using Sarah's meticulously gathered evidence as their foundation. The hospital, under immense pressure, had settled for a massive sum and issued a public apology. Elena Reyes was in the process of getting her nursing license reinstated. Charles Lawson, the CEO, had offered Sarah the position of Chief of Cardiology the day after the board meeting. At first, she had refused. "I didn't do this to get a job," she had told him. "I did it because it was the right thing to do. My life is here, in Seattle, with my daughter. The ER schedule works for us." "Then make the chief's schedule work for you," Lawson had countered, desperate to keep the woman who was now a hero among the staff and a PR asset. "Set your own hours. Name your terms. We don't just want your skill, doctor. We need your leadership. We need to fix the culture that allowed a man like Richard Hartwell to flourish for so long." That was what had convinced her, the chance to make real, systemic change. And she had. Her first act as chief was to co-author a new hospital-wide policy with Dr. Evans and Dr. Reed, the patient advocacy and safety protocol. It created a formal, anonymous reporting system for any staff member, doctor, nurse, technician, janitor, to flag concerns about patient care without fear of reprisal. It mandated that any such report be reviewed by a committee that included members from different departments and levels of seniority. It broke down the silos of power. It gave a voice to the voiceless. Now, sitting in her new office, an office she had insisted be redesigned with a large glass wall to make it feel open and approachable, she was meeting with a new surgical resident, a young black woman named Dr. Imani Wright, who was brilliant ambitious, and visibly nervous. I'm worried about the fellowship match," Imani was saying, twisting her hands in her lap. "Cardiothoracics is so competitive, and I feel like I have to be twice as good, twice as perfect, just to be seen." Sarah leaned forward, her expression kind. "You are good, Imani. I've seen your work. You have incredible hands and a sharp mind. Don't ever let anyone make you feel like you have to apologize for being in the room." She paused, then smiled faintly. "Let me tell you a story. A few months ago, a very powerful man told me I was too dumb to assist in a trauma. He said it in front of a dozen people." Imani's eyes widened. "You're kidding." "To you?" "To me," Sarah confirmed. "He didn't see a doctor. He didn't even really see a nurse. He saw a black woman who he assumed was beneath him. He made the mistake of judging my value based on his prejudice, not my competence." She leaned back in her chair. "Your knowledge is your power, Imani. Your skill is your shield. Be so good they can't ignore you. But more importantly, create an environment where others don't have to fight so hard just to be heard. Use your power to lift others up. That's how we change things for good." Imani looked at her, a new confidence dawning in her eyes. "Thank you, Doctor. I really needed to hear that." "Call me Sarah," she said with a warm smile. Later that afternoon, Sarah left the hospital on time. She drove to Lily's school, the late afternoon sun warming her face. She saw her daughter on the playground, running and laughing with a group of friends, her movements free and joyful. The brutal regimen of treatments had worked wonders. Lily was in remission. Lily saw her, and her face lit up. "Mommy!" She ran over and threw her arms around Sarah's waist. "How was your day? Did you fix any hearts?" Sarah hugged her tight, breathing in the scent of her daughter's hair. She thought of the chaos of the ER, the cold fury of the boardroom, the hopeful face of the young resident. She thought of the woman Hartwell had tried to break, and the woman she was today. "Yeah, baby," she said, her voice thick with emotion as she kissed the top of Lily's head. "I think I did." She had been shoved aside. She had been called dumb. She had been deemed unworthy. But in the end, she had proven that true authority doesn't come from a title or a loud voice. It comes from quiet competence. It comes from unshakable integrity. She was more than qualified to assist. She was, and always had been, qualified to lead. And now, she finally had the chance to do both on her own terms. The hospital was safer, the culture was changing, and her daughter was healthy. She had won. They had won.